My name is Betsy Delora. I'm the CEO and founder of Partners in Sexual Health. We are so privileged to experience the lessons learned in terms of what we're doing with young people with disabilities. We are doing an evidence-based intervention with young people with disabilities, but the focus currently is to actually train the teachers within the school setting, also out of school young people, so that these people can have access to comprehensive sexuality education. There's a huge lack of these type of interventions with young people with disabilities. So I'm very privileged for us as Partners in Sexual Health, with the Medical Research Council, with the UNFPA, to come together to look at the needs of young people with disabilities and to see how we can move this forward based on evidence. And we're hopeful that the type of things that we've learned here within our approach and our training, which we are utilizing the BTS approach, we are hopeful that this type of evidence and work that we're currently doing here will be expanded to the rest of the world.
Breaking the Silence is a comprehensive approach towards sexuality education for young people with disabilities both in and out of schools.
My name is Juliana Hancock, and I work at the South African Medical Research Council, where I'm a scientist who works on sexual reproductive health and rights. In my research, I discovered that people, particularly young people with disabilities, are very vulnerable to HIV, probably also STIs and unintended pregnancies. But no one talked about it. The topic was literally silent. So what did we have to do? We had to break the silence. And that how breaking the silence came about. What we had to do is we had to provide evidence. We had to understand how educators provide, for instance, sexuality education in school. We had to understand what young people need in order to access material, including comprehensive sexuality education. But often we don't know how we implement CSE, comprehensive sexuality education, with learners with disabilities, because sometimes mainstream approaches to CSE don't accommodate them. They are not accessible in terms of communication.
One of my passions is around how do we communicate, how do we teach people who perhaps have barriers to learning, whether that's cognitive barriers to learning or whether that's physical barriers to learning in different ways. And I really believe that this program really takes steps to meet those challenges in new ways. So we can use pictures, we can use visual cues, we can use games, we can use drama, we can use stories, we can use placing things in different categories. We can use lots of tools and then bring those tools to the very complex concepts that we need to learn about when we're teaching about sexuality education.
The practical activities in the BTS lesson plans, alongside visual and tactile resources, offer an interactive approach to learning and make CSE more accessible to young people with disabilities.
I'm a special needs teacher, so I teach classes, and I'm also I operate as a counselor at the school. Now, this course is fundamental for these children, very important, because they're also in the minority in their community, so they're often ignored and they're isolated. They lack a lot of information. They're not gathering information from conversations around them. They need information directed towards them by a teacher or facilitator or a counselor. So this is where this course is extremely important.
The BTS approach aligns with the UN International Technical Guidelines on CSE, the standards adopted by many countries in Africa and across the world. In the BTS 3-day training workshop, educators experience how the learning materials engage with each key concept of the UN Technical Guidelines on CSE.
The breaking the silence approach to sexuality education for young people with disabilities is very special in that it's based in evidence. It has an implementation research component, and it's really aimed at bringing sexuality education in accessible formats that are adaptable for the different types of disabilities.
The Breaking the Silence approach also includes research, policy analysis, and interventions that target the accessibility of the sexual and reproductive health care services for young people with disabilities.
So BTS provides a number of things, and for me the most important things are that first of all we build the skills of the educators. We pick the educators up where they are. We show them how they can apply what we call universal design to teaching. So starting with the lowest common denominator, educators and facilitators really give us a feedback that BTS has enabled them to now go in the classroom and implement what is requested from them.
BTS is an evidence-based approach to CSE for young people with disabilities that shows promise for in and out of school settings. We need more funding and support to make this approach available to more young people to ensure we leave no one behind.